Welcome, everyone. This is Trudy Scott, food mood expert, nutritionist, author of the Anti-Anxiety Food Solution and host of the Anxiety Summit. And today I have the pleasure of interviewing Dr. Datis Kharrazian. And we're going to talk about anxiety and inflammation of the brain, neurons and neuroglia cells, and the blood-brain barrier. And the reason I'm doing this is to give you a taste of what's to come in the upcoming Treating Neuroinflammation course that Dr. Kharrazian is teaching later in May. So welcome, Dr. Kharrazian. Thank you so much for being here today.
Thank you, Trudy. Pleasure to be here.
I'd like to just do a quick formal intro for folks who may not know you. I think most people in my community know who you are and are big fans of yours, as I am. But for anyone who doesn't know Dr. Kharrazian, he's an award-winning researcher, clinician, author, and educator with more than 20 years experience using functional medicine to treat highly complex patient cases. He's a faculty member for the Institute for Functional Medicine, an associate clinical professor at Loma Linda University School of Medicine, and he's on the scientific editorial board for the Journal of Functional Neurology, Rehabilitation and Ergonomics and Alternative Medicine Therapies in Health and Medicine. He specializes in developing evidence-based models to treat autoimmune, neurological, and unidentified chronic diseases using non-pharmacological non-pharmaceutical applications such as diet, nutrition, and lifestyle medicine, which we love. His academic and clinical research has been featured in numerous documentaries, and its clinical models of functional medicine are used by several academic institutions and thousands of healthcare providers around the world. Now, I had the good fortune to attend a number of Dr. Kharrazian's live trainings shortly after I became a nutritionist many years ago in the Bay Area, and I've been a huge fan ever since. So I'm really excited about this training that you're doing, Dr. Kharrazian. And I'm excited to be, have this opportunity to interview you and share a little bit about this, just to give folks a taste for what's coming in this training. And for if you are a practitioner, I've checked out the training, I've signed up, I'm going to be attending, I'm in the Facebook already, and the interaction there is fantastic already. So I'm really excited to learn from you, Dr. Kharrazian, and then also to interact with the other participants. I think that peer-to-peer exchange, I think, is very valuable and is a big plus for a course such as this. Now, if you are not a practitioner, I know that you have said that this is open to, health-savvy consumers as well, but it is geared to the practitioner level. But in case you don't know about Dr. Kharrazian's book, Why Isn't My Brain Working? Fabulous book. There is a section on neuroinflammation in there, and it's great for, if you want to read it, whether you're a practitioner or not, it's a great book to read. So as you can see, I use it a lot. I've got lots of little dog ears in here, and it's a really great book. But let's get stuck into some of the things that you are going to be going into in great detail in this 2-day training. And I just want to also mention it's live in the San Diego area, and it's also available as live stream. So if you can't make it to San Diego, you can get on onto the live stream and tune in. Anything you want to add before we talk about some of these questions, Dr. Kharrazian?
No, also the course will be on demand when the course is done for anyone who missed it.
Oh, perfect. Great. Yeah, so if you're listening to this after the fact, I'll make sure to share a link on how you can get access to it so you can tune in after the fact. So let's start with this whole story of inflammation and how neuroinflammation can, inflammation in the brain, in other words, neuroinflammation, lead to anxiety.
Yeah, sure. The first thing to know about inflammation in the brain is that inflammation in the brain is different than inflammation in the rest of the body because there's different cells in the brain. And the cells in the brain that involve inflammation are called glial cells. And there's different types of neuroglia. There's microglia and astrocytes and oligodendrocytes. And they all behave differently than the immune system outside of the brain. And when the brain gets inflamed, it continues to be inflamed for decades and for many years. And then the worst scenario can be what's primed. But for the most part, there's lots of mechanisms where brain inflammation can cause anxiety. One of the key things to understand about the brain itself is that when you look at the cortex, 90% of the brain is really designed to inhibit the other 10%. So when you look at people that have anxiety, there's different types of anxiety. There's anxiety that's induced by motion and movement, like people are in crowded places. There's anxiety promoted by loud sounds. There's anxiety promoted by light. There's anxieties promoted by just psychological thoughts at rest. There's anxiety promoted by sense. And these are all different areas of the brain that are firing but aren't being gated. So when you look at the input to the brain's constantly getting all these inputs, and even your thoughts are really inputs in your frontal cortex. But then you have different areas of the brain called the basal ganglia that dampen the thalamus and different outputs. And then you have different parts of the brain, the cerebellum, called the Purkinje cells. They inhibit inputs coming in from motion and movement and those types of things. But when the brain's inflamed, it really can't function well. And one of the key function of the brain is to inhibit the other 10%. When you get someone who's got chronic inflammation in the brain, they're almost guaranteed to have some form of anxiety based on which areas the brain are more involved, or even which areas of the brain have been degenerated before the inflammatory sequence. So I'll give you an example. If someone has some subtle neurodevelopmental issues in their cerebellum, that's the back of the brain where you have motion, movement, and coordination, and that area is already starting to degenerate a little bit, and then someone gets an inflamed brain and they can't activate that area, then they can't suppress all the inputs that are coming in from gravity to your muscle spindles and joints and movements that your body is doing throughout the day. And then motion and movement itself can then fire into autonomic centers, and someone can have the heart rate go up just by being in a crowded environment. And that's a very specific type of neuroinflammatory response. So one of the things we do, and one of the things we're going to talk about in the course is like, this is neuroinflammation. These are different regions of the brain. And when these areas of the brain start to really become impacted, you can have these different expressions. And I think we use the term anxiety as just like a global thing, but there's different mechanisms for anxiety, like I was saying, motion-induced, sound-induced, light-induced, and cognitive-induced, and these are all different regions of the brain that are involved. So when we do a detailed functional neurology workup, we go, well, anxiety from what? So we can have one patient, we'll put them on a heart rate monitor, and we'll basically just put a tuning fork next to the ear and see if the heart rate goes up. That's different than a person who's got anxiety. You put him in a chair and you try to spin him a little bit and their heart rate goes up. And different than someone who's got anxiety who just thinks of a thought that's has some stress within them, the anxiety goes up. So, but the bottom line is when a person suffers from anxiety, to us in a functional neurology clinical model, it just lets us know that the parts of the brain that normally gate input are not working. And one of the major causes of that is neuroinflammation.
Okay. So you're mentioning here firing and this gating mechanism. Can you just touch on that a little bit more?
Sure. So the way your brain works is the way all of our brains work is the brain is constantly getting input: sound, light, smell, taste, movement, right? They're all firing to the brain. And then we have to have pathways that dampen that suppress that. So the brain gets activated and those reflex loops that then suppress it. And when those pathways don't work, you can have significant degrees of anxiety develop. Now, a really common one is when people get neuroinflammation that progresses into autoimmunity. So you get inflammation in the brain, and then their immune system starts to attack an enzyme in the brain called glutamic acid decarboxylase, GAD. And that's the enzyme that makes GABA. So you just have some people that have significant inflammation in the brain. They start to make GAD antibodies, and when they make GAD antibodies, they can't produce GABA in the brain, and that's the pathway used to gate or inhibit these different regions of the brain. So that's a very specific mechanism, and you can measure that with what's called GAD antibodies with a lab test. Very common with also patients that have diabetes, type 1 diabetes. They also have co-occurring GAD antibodies, and very common in patients that have celiac disease. So there's really no shortage of mechanisms that can impair gating in this whole anxiety response. But I think the key thing is when a person does have anxiety is the first question is the brain working and is the brain healthy? And if the brain is inflamed, there's no chance that the brain can do its job.
Yeah, so you can work on everything else, the diet and the lifestyle factors and the nutrients, but if you don't deal with this neuroinflammation, you're missing a big piece of this, and this is what we're going to be addressing in this.
Right. And then the only major breakthrough that's also come out is this concept of what they call glial priming. So you can have transient inflammation of the brain, and that would mean like there's some days your brains are inflamed and then some days where it's not inflamed. So an example of that would be, for example, someone who's sensitive to a food protein, they get exposed to the food protein, most common one being, let's say, gluten sensitivity. They get exposed to gluten, they get some brain inflammation in a few days, they can't think, they can't focus, and it goes away. So that's a transient brain inflammation. Then the next level up is like chronic neuroinflammation. With chronic neuroinflammation, the brain just always inflamed. And there's always a brain fogginess and depression, and a slower conducted speed, and this person struggling through the day. And then you have what's called prime glial cells. And this is a completely different mechanism. And this happens when the microglia in the cells get activated so aggressively that they actually change their structure into a inflammatory soldier and then never change back. Just like how a hard-boiled egg, once it becomes hard, it never becomes soft again. So these glial cells get primed, they actually change their structure and their shape. Like a great example is that a traumatic brain injury. So we know if someone has a head injury, those glial cells can now change their shape and be structured towards an inflammatory state, and they'll be that way forever. And then we know that over time, they actually get more and more active, and they start to spread inflammation throughout the body. And this is the only thing that's coming out of the research with chronic traumatic encephalopathy, where you have these soldiers that get a head injury or blast injury and then start to get PTSD years later. And in the U.S., they're doing a lot of research with football. You guys call gridiron in Australia, but they're getting these head injuries and then they're having suicidal impacts and things down the road. So those are a whole different scenario of patients. Those are called glial priming patients. And they're completely different than chronic inflammation. They're completely different than transient inflammation. They're completely different than neurological autoimmunity. So one of the things we're going to be talking about in that course is teaching people about that. And once, the difficult thing is that people don't always understand that their brain injury has caught up with them years later. That subtle car accident where they kind of felt okay for a few days has really now had an effect. Or the sports they used to play and used to get dizzy at times really can affect the brain. And in those cases, you just have to constantly look at strategies to dampen the inflammatory cascade. So that's another key concept I think clinicians really need to make sure they understand, like how to differentiate between transient, chronic, and prime glial cells, and then how to discriminate between neurological autoimmunity, because they're all different and they all have different prognosis, but all of them can cause some degree of inflammation, but some are more severe than others. Some degrees of anxiety, I should say.
Right. And I'm glad you mentioned the mild, TBI. You think of a traumatic brain injury as being something really severe where you may have had a concussion or you may be out for, unconscious or out of action for a long time. But there's a lot of people who've had small bumps and car accidents over their lives, and that we need to be aware of that. So I'm glad you brought that one up.
Yeah, and especially if you've ever lost consciousness during the head injury. If you've had loss of consciousness during the head injury, it's almost guaranteed you have some glial cell priming. And the other thing we know about research is it's also not how hard you hit your head, it's how active your glial cells were before the brain injury.
Ah.
So if you already had inflammation in the brain, let's say you were a smoker and you were hypoxic, that will create your glial cells to be more inflamed. If your blood sugar was a little bit high, that would also inflame your glial cells. If you had an inflammatory diet, that would enhance your glial cells. So those predisposing factors can have a head injury have a completely different effect with someone else who has the same degree of head injury, but their cells aren't already activated with an inflammatory cascade. So even mild head injuries can be devastating for some people, especially if they're already inflamed, or some people have inflammatory bowel diseases, or some people have autoimmune diseases and they have RA and then they get a car accident. Mm-hmm. It's a completely different scenario. Than everyone. So everyone's when people get a head injury, they usually go, "Well, it didn't hit my head that hard." You're like, "Well, that's not the only variable."
What else is going on? That's very interesting because we know with PTSD, if you are nutritionally sound, you're more resilient to it. Whereas if you you're deficient in certain nutrients or you've got something else going on, you're going to be more affected by it. So it sounds like this is a similar type of situation. You've got depending on what else is going on, it's not just the head bang. What about if you hit your head and you're not unconscious, but you sort of see stars, and I suppose that could be a factor too, depending on what some of the underlying factors are.
Absolutely. And if you're seeing stars, then that's hypoxia to the brain. Wow. So what happens is inflammation uncouples the mitochondria. You don't get oxygen to those regions, and then you start to get the stars or the fogginess and so forth. It's a really bad sign.
Wow.
Not to scare everyone that has a head injury, but if you've had a head injury, if you look at your history and timeline back to when you started to fall apart, and if you see a time frame where everything was fine and you got a head injury and then things started to decline from that point of injury, it's very likely you might have glial priming, and the glial priming can cause significant inflammation, and that inflammation can impact brain health, and that can lead to anxiety. So your brain's unhealthy enough to dampen its inputs. And really, at the end of the day, you have to heal the blood-brain barrier, look at all the different variables that trigger prime glial cells, make sure you don't have them in your life, and then try to, get out of that inflammatory cascade.
This is very interesting because I have a rock climbing background, and I've had a few falls rock climbing, nothing on my head, but I've had a few rollover car accidents and a snowboarding fall. So, doing courses like this, I'm always wanting to learn in order to share with my community, but also I know we often do courses like this because we think, oh, this is interesting, maybe I could learn something for myself. So I'm very interested to learn more about this at a personal level for family members and then also for my community.
Right. And then we're really lucky because I have two of my own patients that are sharing their story with us. They both have significant glial priming, and they wanted to really share their experience with healthcare professionals, and also we can see their clinical responses. And I didn't pick the ones that were the perfect ones, everyone got better. I picked the ones that we're struggling with and those ups and downs and the real clinical scenario. Because I think, in the world of clinical practice, I think too many people teach and they paint this image of rainbows coming out and everything's perfect and if you just do this one thing, but that's not real. And what's real is when people have significant brain injury or neuroinflammation or PTSD or anxiety, is that they are constantly dealing with these ups and downs. And for many of them that are really progressed, a good clinical goal, a realistic one, is to try to have much more good days than bad days, and how to recover sooner, and then how to function with not having 12 hours of sleep to get through the day, and not being able to go anywhere in these things. So if you can just change a few of those things, I mean, those are big things, big deals in a clinical scenario.
Yes.
So we'll have these reviews of these patients' cases, their entire file from who they've seen, all the lab tests they've ever done, their history in detail. And then people will be able to read those before the course. And then at the course, we'll talk about treatment. We'll have some video of them talking about their outcomes and what worked and what didn't work, what they were feeling, what they were going through. And then throughout the year, we'll be doing some live Facebook chats with them to see how they're progressing and what's not working and what is working. So I really wanted the Kharrazian Institute program that I'm teaching all these courses through to be for clinicians, for real life, not really a big hype, not a real big promotion, but and we might totally fail with these cases. I might totally fail with these cases working with them, and we may need help from other people that are on board, and it'll be a good learning environment for everyone. So, but that's the only real way to learn clinical treatments, is to actually see real clinical scenarios, work with, learn from people that are actually doing it in their practice, and then combine the research with clinical cases, and then really think through it, and then have the ups and downs, and then think your way through it. That's how it works.
Valuable. We're going to be shadowing you, which is very, very exciting. And I love that you're going to be, giving us the file information. We're going to be hearing about it during the training, and then this ongoing interaction. And one of your patients is already communicating in the Facebook group. He said, "Hi, I'm one of the case studies." And so he's there. He's going to be interacting with us during the course, and once the course is over. So that part of it, really excited me as well. I think we can learn from books. We can read a book. We can, even do some coursework, but to actually have this interaction with you walking us through this, and then with someone who's actually living it, I think is just going to be invaluable. So
yeah, and I think it's a good community. We have for the first course, we're still not done with registration, but we're up to close to 800 registered people from all over the world, really, all different professionals. So we're all going to learn from each other in our community, and the patients are going to help us think about certain things. And many of the practitioners are patients, right? Many practitioners are
absolutely
they're suffering themselves.
Yeah.
So when you teach a course in neuroinflammation, you're guaranteed to get practitioners who suffer from neuroinflammation as people that are taking it. Just like if you were teaching a course in diabetes, you get practitioners for the diabetes.
Exactly.
So and for me, when I was teaching a lot on the road, my greatest growth came from just the conversations with other practitioners. It wasn't even the material, So we'll have an excuse to have PowerPoints and review the research, but really we're all going to grow is just sharing ideas with each other and then discussing concepts and discussing the cases that we all have, and really making it a clinical environment instead of a commercially environment, and just really be able to all find different strategies to help patients grow. Like I said, I'm interested to see what you're doing with anxiety and other people are doing.
Yes.
And I think everyone is. So
yeah,
we're all ready to learn from each other. So we're trying to create a healthy environment where, we have a topic, we have all the research reviewed, which is exhaustive. I do it on my part, and I share at least some videos and put myself up like, hey, this is the best I can do. Would you guys miss anything? Do you guys see anything? And then have the patients really truly interact without any hype of what's helping, what's not helping, and then really getting everyone's input. I think it's going to be a great learning environment.
Yes, absolutely. And the learning from each other, I think, is invaluable. And you talk about the research. You are just amazing for the research that you pull together and that you share. And you've always done that. I remember that with the first training that I did with you. And it's good to have that research, but we need the balance. We need the peer-to-peer sharing. We need the live case studies. And everything. I think it's really, really exciting. So I just want to share the dates. Again, it's Treating Neuroinflammation. It's May 18th to 19th live in Southern California. And then there is the live stream option. And then as Dr. Kharrazian said, you can get access to the training material afterwards. And I'll be in the live stream option, and I can't wait to learn more and connect with all of you on the Facebook group. And any final words for us, Dr. Kharrazian?
Thank you for having me, and I hope to be back and talk to you some more.
Okay, great. Thanks very much, Dr. Kharrazian.